Okay. I'd like to welcome everyone to this meeting. First public meeting of the Broxtowe Save Our NHS campaign, which has been set up under the auspices of the Nottingham Trades Union Council. My name's Liam Conway. I'm the president of Nottinghamshire Trades Union Council, and I'll welcome you all here tonight. Obviously, this is a very, very big issue, and one which there's still plenty more to play for, even if the Health and Social Care Act, misnomer if ever there was one, has actually become law. We've got a number of speakers tonight, and I'll introduce them at the time. Just a few opening remarks. I've got a lot of admiration for the man who was first behind the NHS. That's Nye Bevan MP. Now, I don't have a lot in common really with Nye Bevan. He was Welsh and I'm Irish. He was a little bit older than me. He was a Labour cabinet minister, and I unfortunately have been expelled from the Labour Party. So I don't have that much in common with him on those sorts of personal fronts. Not that I know much about his personal life. But what I do have in common with Nye, and it's a quote that goes around the Facebook sites and Twitter regularly, and that is a seething hatred of the Tory party and every single thing that they stand for and ever stood for and ever will stand for. And what the Tory party is, and it's largely the Tories, of course, that is behind the Health and Social Care Act, despite their little kind of mini-me's in the Liberal Democratic Party. It's the Tories that are behind the Health and Social Care Act. I think it's really good that at the Labour Party conference, they made a commitment to repeal that act and to scrap it. I'd like to see Labour go a bit further than that and promise to reverse all of the cuts and in the health service and to bring all parts of the health service back into public control where it belongs, where it started when Nye Bevan helped to set it up. Because what we're seeing here in what's happening with the health service is morally wrong. It's just a clean issue of what's right and wrong, and what we're seeing is completely wrong. And what it does is it risks the health and lives of actually millions of people, millions of the most vulnerable people in our society. We see in America what a privatized health service can do, and you get in America, along with many, many other things, you get situations where people with pre-existing conditions are not entitled to health care, where people think they're covered by insurance and then find that they're not covered and end up dying painful deaths or being denied life-saving treatment. So we don't want that sort of healthcare system in Britain, and the American people shouldn't have to put up with there either. I think it's important to support workers in the health service who are fighting against cuts, that campaigns spread to support those people, and that we help those to return the health service to full public ownership. Now, I'm sure there are nurses and doctors and others here tonight who work in the health service, and it's my view that we shouldn't be handing the health service over to private sector sharks. What we should be doing is strengthening the role of the people who work in our health service and the people that use our health service. Our health service should be run by a combination of the workers that work in it and the people that use it, and then we'd get a fully democratic health service, which is what we should all have. Okay, let's go on to speakers. The first speaker we've got tonight is a health service worker, Sharon Vesalian, who's the Assistant Branch Secretary of Unison at Nottingham University Hospital. Round of applause for Sharon, please. Sharon.
Good evening. Can everybody hear me? I'm not used to microphones. It might sound a bit reedy, so I do apologise, but there's so much to go through, so I do apologise if it sounds like I'm reading everything. The new NHS Act has caused a lot of controversy since the release of the original white paper entitled Equity and Excellence, the Liberating of NHS, on 12th of July 2010. This was published only 2 months after the general election, contradicting the promises made by Cameron and Clegg to keep the NHS public. Upon browsing this paper, I realised that the word equity did not meet the dictionary definition. The proposals would create a greater divide between those who have and those who don't have anything. As for liberating, I think it meant from the hands and the accountability of the people to the private sector. Despite mass opposition from doctors, nurses, NHS support workers, unions and the general public, including a lame exercise in listening, the government delayed closing Parliament in